All right, so lead placement. We talked about your regular limb leads, 1, 2, and 3. Most electricity is flowing towards lead 2 from that shoulder up on the right down towards the left leg. We also know that when we put on a 4 lead configuration, that when these 4 leads are placed on your patient, we will get additional leads. These augmented leads allows us to have different sentinels looking at the electrical impulse traveling, in this case, towards the feet, towards the left, and towards the right side of the heart or body. The additional lead placement was after you place this center limb leads on, you need to then configure and place on your 12 lead EKG, making sure that this harness is connected in order for it to capture. And so make sure when you are using this equipment, before you press the 12 lead acquire button, it just looks a little more practice that you remember that you have to place this in there. So let's go over the lead placements for these V leads. These are the precordial leads. They go across the anterior surface of the chest. It may also go towards the back and posterior side, which is a little far and beyond this part of the course. But let's talk about lead placement for V1. Where is V1 going to be placed? All right, so fourth intercostal space, right sternal border. Make sure that it's not that far and it's not too close to each other, right on the sternal border, okay? Because if you place it too close to each other, too far away, it's going to sense the energy being just slightly, it just reads it slightly differently without the correct spacing. How about V2? Fourth intercostal, very good. Now, can we get lead 3, V3? No, so we have to do V4 first, is that correct?
Yes,
So
sir.
I do V4 first, and what are we looking at? What intercostal space? Fifth intercostal space, and that's the left side, right? On the left midclavicular line. So we're looking at that left side. Now we can find V3, and V3 goes between. All right, so we have last 2 leads over here, V5 and 6. What intercostal space are we doing for V5? Fifth intercostal space, and this is the left anterior axillary line, just on the outside of this pectoral muscle, and the front of the this arm or left limb, upper limb. And then the fifth intercostal space, that's directly underneath, so mid-axillary line. Another lead that they might tell you is, can you place on what's called V4R? It's the same placement as V4 here on the left, but we're going to be placing it on the right. So you're just going to take the V4 lead off. You'll leave the sticker in place. You'll put another electrode on it, and then you place it right here. What intercostal space on the right side now? Fifth intercostal space, right mid-clavicular line. So this will be showing us energy and that flow of energy from the heart going towards the right side now. Right side. So this is your lead placement. Again, we're using, if you look at this, these are very tiny pediatric size electrodes. And what happens is that they don't have a lot of surface area. This may pick up energy fine, but you need to make sure there's a lot of conductive jelly underneath. And we might want to use slightly larger electrodes if we have a patient that we really want to take a look at. But I've noticed that we've gone to using these smaller electrodes. Anyhow, this is your 12 lead placement. If you need to do one on the right side, you would put it in the fifth intercostal space, right mid-clavicular line, to take a look at the right side of the heart.